Hi, my name is Mary. I am a nurse who also does interviews for new grads, and I coach new grads for their first nursing interviews on my days off. And today I want to talk about the question, tell me about a time when you provided culturally conversant care. Culturally conversant is sort of a newer term that people are using. It sort of implies that there's always more to learn about other cultures and you're never like culturally competent, which was sort of the older term that people were using. So this question is very common. Most hospitals ask some version of this question. So for this question, what you'll want to do is you'll want to tell a story about a time when you had a patient that had another culture and anything that you did to help them feel more comfortable during their stay based on their cultural preferences. I've had a couple people in my coaching session say something like, because I speak in whatever language it was, this patient expressed this medical concern and I assessed it and helped get them the treatment they need and explained everything. And while it's super great that they were able to help the patient feel more comfortable by being able to speak their preferred language, anytime that you do any kind of patient care that is medically related, you have to be medically certified in that language. Otherwise, you need to use the translator. But it's fine if you're just talking about like food preferences or temperature preferences of water or anything that's not medical that you did to help them feel more comfortable. Totally take credit for that. But make sure if there's anything that you're mentioning that you did medically related, you would need to honestly be able to take credit for using a translator in that circumstance. So we are going to go through a couple scenarios that people have given. These are new grads who got the job that they applied for, and these are the interview answers that they prepared for their interviews that they actually used when asked. Another answer that I don't believe is in these examples is there was someone who said that they had a patient who was Muslim, a female patient who was Muslim, who needed to undress for an exam, and the doctor was male, and the nurse was able to facilitate the exam being done by a female provider to be more respectful of the preference for modesty in the Muslim culture. That's a super common example that people use. Other things that people talk about is if they were able to speak to the family members or use the translator to find out what somebody's preferences are with just anything that makes them more comfortable. You know, some people, based on their culture, they want ice water versus some people like hot water and hot tea and warm blankets. Or maybe somebody has a favorite food that's kind of more what they're used to having at home that helps their appetite and helps them get stronger while they're healing up. Anything like this that you can mention from your clinical experiences is great. Hopefully listening to these example answers will jog your memory of something that you can take credit for and talk about in your nursing interview.
For that question, I would say when I was working with this male nurse whose patient was Muslim. I can't remember what brought her into the hospital, but she needed to get an intermittent catheter done. And I knew that, her culture, there's a big emphasis on just staying modest. Like modesty is a big thing in their religion and in their culture. So since I came from medical surgical floor and I was trained on how to, do Foley catheters, I offered my nurse to to do the straight cath for that patient so that she wouldn't feel uncomfortable and, like, especially because he was a male. So.
Can you please tell me about a time that you provided culturally conversant care?
Culturally conversant care.
So like they used to say culturally competent, but they're thinking like that kind of makes it sound like you become like proficient and you like don't need to keep engaging in like learning. So they're now the term that they're using is culturally conversant. So what a lot of people say for this is like that they had a patient and they worked with the interpreter or like the patient's children or whatever to find out what their preferences are and be sure to pass that along in the report, whether it was like they only like hot water or they don't want ice or like they love warm blankets or like
Oh,
they have
I
like
see.
they really like rice and juke or whatever like their favorite.
Yeah,
You learn their preferences and it kind of helps, like little things like that that's like tailored to their culture.
got it. I feel like I don't have any like life-changing stories with this one. It's kind of just more like
Just little things.
little things. Okay.
Yeah.
I mean, hmm. I mean, I think there's one time, maybe this is like when I first started nursing school. I had a Vietnamese patient, didn't speak much English. His family wasn't there, and he was complaining about something, but we had no idea what he was complaining about after we gave him the food tray. And then after that, we kind of got the interpreter in, and then to figure out what was going wrong. And then from that day, I kind of knew about this, but for him, it was like that. Some Asian cultures they don't like drinking cold water in the morning. So from now on, then I try to be more culturally conversant in a sense that to bring them not cold water, I guess something along those lines. I remember,
Yeah.
but
Or you could finish it up by saying that like from that experience it taught you to, like while you're taking the food order, like ask what their preferences are with that, and
oh, okay,
how like little things like that you've found like you like to try to do anything you can to try to make them feel more at home, more comfortable while
okay,
they're stuck in the hospital.
got it.
Yeah.
Okay, thank you. Sorry, that's a hard one for me.
Yeah, and you can talk a little bit about how like that's part of what you love or something like that too.
Okay,
That you get
got
to
it.
like learn things like that you wouldn't otherwise know.
Yeah,
Yeah.
got it. I'll make sure to
Um,
include that.
can you please tell us about a time when you were able to provide culturally conversant care?
Yeah, so one time during my rotation I had a patient who did not speak English very well, but instead she only spoke Spanish. And I was, while providing care, um, she was reporting that her IV was hurting, and being, and I have a somewhat of a Spanish speaking background. I asked her in Spanish to assess her IV, and she said it was hurting. So I reported that finding back to her nurse, and we figured out her IV was infiltrated, so she needed to get a new IV.
So,
Or like, I feel like that's like how I said that. That was probably not a good way of saying it, but
well, we can work with this.
Right.
So here's the thing, like, so I speak Spanish too. So are you medically certified in Spanish? No. So
but I know some words to get around.
So if you're not medically certified, you can ask her like what she wants for lunch. You can talk to her about her grandkids, but like the minute it's like assessment or like anything medical, legally you're in trouble if you don't use a translator.
Okay, then we won't.
Yeah. So you can say,
okay, so
like, did you maybe help her get like the kind of food she wanted, or did you help her get like blankets when no one knew what she was asking for, or like something non-medical for her?
Yeah, I could do like blankets because she was saying she was cold.
Yeah.
I provided her like some extra warm blankets.
And you can say that you like rounded on her a couple times throughout the shift, just to make sure that she was like given opportunities to ask for the things that she needed to be more comfortable.
Okay, but just like again, so the moment you say assessment and you're not medically certified, don't say it. Don't say it. Okay.
No. Like, so you could say like you had a patient that spoke whatever language it was, and you noticed that their appetite was poor, and you made sure to not only work with the translator to help find foods that they liked, but to also talk with the family when the family was there to really help learn all of their preferences, that they want hot water with their meals and tea, and that they like, being like, they have a belief that being cold is not good for healing, and so to make sure to always provide like hot water and warm blankets, and just like be mindful of their preferences, and to make sure you really are giving them like a lot of opportunity to voice what's important to them, so that you can kind of tailor their care.
Okay.
And you can talk about how like the most important part of it for you was like just being curious and listening and asking questions. Do you want to give it a go?
Okay, yeah. For like the most important part of it, like when being curious and asking questions, does that like go under mainly like what I did, or like what was the outcome?
Just kind of how you frame it. So you could say, I love how area we are lucky enough to have patients from a lot of different cultures. And I found what's most important is to really take the time to listen to them and find out what their preferences are. I had a Cantonese speaking patient, and because I was able to use both the translator and speak with the patient's children, I got to learn that they feel that being cold is not good for healing. And that let me know that to tailor care to them, I can do little things like bringing warm blankets and providing hot water. And initially the patient's appetite was very poor, but with the help of the translator and the family, I was able to find things on the menu that the patient did like that actually helped us get good nutrition for the patient to help them improve quicker. And the whole experience just illustrated with other cultures how important it is to just talk openly and really listen to what it is that they feel would be the most helpful for them. Something like that.
Okay. I like that. Oh my gosh, Mary, how do you like get that to flow out so easily for you?
I'm so
like,
much better on paper with it. When I try to say it out loud from scratch, it always just feels like a bunch of mumbo jumbo. Like I usually have to do it on paper first.
Really? Because like the moment you just like let that out first, I was like, dang, like it sounds like you already like
I've heard a lot of interviews. Heard a lot of interviews.